Good afternoon and welcome. This webinar is a collaboration between the U.S. Department of Veteran Affairs, VA Center for Faith-Based and Neighborhood Partnerships, and Veterans Health Administration Homeless Program Office. My name is True Lester Pauling. I will be your moderator this afternoon. I am the Senior Program Specialist at CFBNP. Everyone's phone has been muted. If you have a question during the presentation today, please type it in the Q&A screen on the right of your, in the Q&A box on the right of your screen, excuse me. I will read the questions at the end of the presentation, and the presenter will provide a response. The presentation will be sent to everyone that registered for this webinar today. This is a live recording. I would like to thank Mr. Shawn for this collaboration. We are grateful for your time today, sir. Before we get started, I would like to pass on my apologies for Mr. Washington, the director of the VA Center for Faith-Based and Neighborhood Partnership, for his absence today. If he was here, he would provide opening remarks. However, I will provide a short summary of his bio. Please see it on the screen. Mr. Washington is a retired combat Marine with 20 years of active duty service. He is a licensed minister actively serving in his faith. He received his ministerial MDVIB in pastoral studies from Moody Theological Seminary, his master's in business management, and a bachelor's of science degree in education. Additionally, he is a graduate of VA class of 2017 Virtual Aspiring Leaders Program. At this time, I would like to introduce our presenter for today, Mr. Shawn Liu. Please read a summary of his bio on the screen. Mr. Liu is the Director of Communications for the VHA Homeless Program Office. He is responsible for developing strategic communications that enhance efforts to prevent and end homelessness among veterans and their families. His office hosts a monthly podcast entitled Ending Veteran Homelessness. It offers a look into VA's nationwide efforts to help veterans experiencing and at risk of homelessness. Mr. Liu also supports the development and implementation of national policies, plans, guidelines, and technical assistance for a variety of VA homeless programs and initiatives. This summer marks Mr. Liu's 16th year working at the VA. He holds a Bachelor of Arts in Psychology from Florida International University and a Master's of Social Work degree from Florida State University. He is a licensed clinical social worker with the state of Florida. At this time, I give you our presenter for today, Mr. Shawn Liu. Shawn?
Thank you so much, Ms. Pauling. Hello, everybody. Really excited to be here with you today to talk about a topic that is a really important topic, a topic that I'm passionate about. It's veteran homelessness and the resources that VA has to not only reduce, but hopefully one day end homelessness among veterans. I've got a pretty packed agenda for you. We're going to go over a lot of material. And of course, I always love to leave time at the end for your questions. So without further ado, let's go ahead and get on in. This is our roadmap for today. I'm going to start off with some introductory concepts just to level set about what we mean when we say homeless veteran. Then I'm going to give you a progress update to let you know how we've been doing in our nationwide work. Going to tell you about our goals from last year, some of the things that we've been delivering for homeless veterans. Then we're going to go into providing just a high-level summary of the different types of assistance that VA provides to veterans experiencing homelessness and housing instability. When we get to that section, just kind of thinking ahead, I don't want you to, feel like you have a lot of pressure to memorize all of these different acronyms and program names or to become an expert in the next, 50 minutes on all these programs and services. I just want you to know that they exist so that if you or yourself or you encounter a veteran who's experiencing homelessness or housing instability, experiencing a housing crisis, you know how to get them connected to us and you have a general sense of what they can expect. Then, as we close out, before we get to your questions, I'm going to just share some opportunities for you that you can help us into this work and some other opportunities to stay connected and engaged. Okay, without further ado, let's continue on with some introductory concepts, just level setting a little bit so you have some of the jargon, some of the terminology that we use so that we can have some fun conversations as we go forward. All right. So the concept, homeless veteran, I'm going to unpack that a little bit. This phrase, homeless veteran, has two components. It has an adjective, homeless, and a noun, veteran. First, I want to talk about that adjective. What does it mean to be homeless? Now, there are a lot of different definitions of what it means to be homeless that are floating out there. Some of them are more inclusive and broader. Some of them are narrower and a little bit more restrictive. This here is the federal definition of homelessness. This comes from statute. It actually was originally codified into law by the McKinney-Vento Homeless Assistance Act of 1986, I believe, 87. I think I was 6 around the time. It was later amended by something called the Hearth Act. I actually don't remember the full acronym, but that was passed into law in 2009, 2010. And it basically created 4 categories of homelessness that if you were a person in need and met one of these categories, you would then be eligible for homeless programs and services. This, by the way, is the definition that we at VA use when we determine eligibility for programs and services. All right, 4 categories. Category 1 is the normal traditional sense, which is, and the terms here are a little bit jargony, so hang in with me. Category 1, when a person lacks a fixed, regular, or adequate nighttime residence, such as folks who are living in places like emergency shelters or transitional housing. Those 2 programs, those 2 types of interventions, oftentimes are what we call congregate settings, a big building where a bunch of homeless folks stay. And it could be short term, it could be longer term, mid-term. But if you're staying there specifically because you're homeless and you're still considered homeless while you're there. Or places not meant for human habitation. So this is, think literally on the streets, literally in the woods, in encampments, under bridges, really, really dangerous situations. Those folks are also considered homeless. And those 2 conceptualizations, emergency shelter and transitional housing, and places not meant for human habitation, is category 1. Category 2 talks about imminent risk of homelessness, that without some type of intervention, you're going to meet that first category. You're going to have to go to a shelter, or you might be actually physically out on the street, oftentimes conceptualized within 14 days. Category 3 speaks to the families, the youth with minor dependents, families with minor dependents and youth. And in homeless services, we think of youth not just as 18 and under, but 25 and under. And it gets into a lot of like early development and kind of resources and all that jazz as well. But what this touches on is the fact that for families with minor children or youth who are under 25, their homelessness oftentimes looks a little bit different. They experience something we call couch surfing or being doubled up. And this is in contrast to like roommates and staying with families and friends long term, that in this category, in this third category, it's not just being doubled up, but it's like I'm at my friend's couch and then 2 weeks later, I got to go to my auntie's couch. And then maybe 3 weeks later, I got to go to my uncle's couch. But my uncle only lets me stay 3 days. So now I got to go again. That sounds and feels pretty disruptive, right? If you imagine yourself having to hop and hop and hop every couple of days, that's very disruptive. And because of that disruption, that is our third category of homelessness. The last category of homelessness that usually impacts especially women veterans, are those who are fleeing domestic violence or other life-threatening circumstances. And those folks as well often don't live in shelters or on the street. They often are couch surfing, similar to families with minor children or youth under 25 years of age. And if they're fleeing domestic violence or other life-threatening circumstances and they're having to be couch surfing, but definitely if they're in a shelter or an unsheltered setting, they too are considered homeless. Okay, let's keep going on to the next slide. Let's see, it's a question. Please check your mic. Yeah, we are showing the slides. So let me know in the chat if you can't see the slides, but it sounds like we're still good. So that unpacked what we mean when we say homeless. This definition now, the noun of veteran, we're going to talk about what we mean when we say veteran. I want to acknowledge, because there are folks on this call, recognize your names. You work for VA. You might be familiar with the definition of veteran for VHA healthcare eligibility. And so what I want to acknowledge is that this is a very broad definition that I'm showing you right now. This definition is broad such that it speaks to our overall nationwide efforts to end veteran homelessness. So when we think about the goal to end veteran homelessness, a person is a veteran if they served in active duty of the armed forces, regardless of how long they served or the discharge type that they received. And again, I want to acknowledge this is intentionally broader. I think my camera just conked out. This is intentionally broader than, say, VHA healthcare eligibility, and broader still from the eligibility criteria for many of our programs. Okay, yeah, turn it off on purpose. Great, that sounds good. For many of our programs. But what this tells us is that regardless of a veteran's discharge status or active duty time, that it is our collective responsibility as a country to ensure that every veteran has a safe and stable place to call home. All right, that's what we mean when we say homeless veteran. That's what we're talking about in terms of the scope of the work that I'm going to talk about in the rest of this presentation. Now, you may be wondering, well, Shawn, okay, that's what it means to be a homeless veteran. Why do veterans become homeless? What's all that about? And you're probably kind of thinking, especially if you've been watching some of the news lately, or reading your local newspapers or national newspapers, and you're saying, Shawn, is it the drugs? Is it the alcohol? Maybe it's the mental health. It's got to be that, right? That's the reason why veterans become homeless. And I want to kind of maybe invite you to consider that the picture is a little bit more complex. What we're looking at here is basically the super high level summary of a bit of research that was done by our VA National Center on Homelessness Among Veterans. And it basically looked at risk factors of why a veteran may become homeless. And they categorized them in two different components. Individual factors, and these are things that are consistent with the actual veteran, why this veteran as opposed to that veteran may be homeless or not homeless. And these are things that are often pretty intuitive for you, right? Things that you can probably say, oh yeah, Shawn, that's definitely it. Substance use disorders, lack of stable income or employment, history of incarceration, lack of social support, adverse childhood events, right? These are things that kind of make sense because we often intuitively think about the individual. What are the things that went wrong in this person's life that made them homeless? But that doesn't quite explain why, certain geographies or regions may have more homelessness than another, right? And so what this research study encourages us to consider are what we call system level factors or the environmental factors. Basically, the things about the communities that these veterans may be living in that may lead them to be more or less likely to be homeless. And these are things that may not be the most intuitive, but when you start thinking about it, makes sense. So whether or not your communities have affordable housing around your neighborhood, is the rent affordable? Are there economic opportunities that are not available? What's the job market like? And what are other neighborhood or cultural factors that might be at play? And so when you think about veteran homelessness, both on the individual level and the community level, you can see here, it's not just one thing. It's not just the drugs, or it's not just the mental health. It's this mix of individual and system level factors. And you can be unsurprised to know that at VA, our goal here is to minimize and address all of these different factors. Oftentimes at VA, especially in the Veterans Health Administration, we have resources to address the individual level factors. And that sometimes we are also challenged through partnerships with good folks like you to start working on those system level factors as well. Let's go on to the next slide, please. This is a summary from an earlier study. This is actually from 2013. I want to acknowledge both of those studies are the before times, before the pandemic. What this looked at were 4 risk factor profiles in 2013. It was an assessment of 100,000 veteran records to identify certain trends. And some of them are pretty intuitive, again, like things that you would have anticipated. Substance use disorders and mental health conditions. That's a risk factor profile that if you were a veteran with those two conditions together, your risk of homelessness would be increased. And that makes intuitive sense. Substance use disorder, incarceration history, and poverty. That also makes sense, right? You think, oh yeah, just as an aside, history of incarceration, especially for single adult males, is one of the most powerful predictors of individual risk factors for homelessness. It's massive. And we're going to talk about what we do for outreach to veterans who are involved in the criminal legal system a little bit later. But that's pretty intuitive. That makes sense. Disabling medical conditions. That also makes sense. We historically have seen a lot of veterans who were homeless, and some of the kind of precipitating factors were physical disabilities. But this one here in the top left might be scratching your head a little bit. Like, Shawn, what do you mean relatively few problems, right? And if you're scratching your head, there's probably a good reason for that. Relatively few problems gets into the idea of there are certain areas, certain communities, certain structural factors that fewer things have to go wrong for you to end up being homeless, right? So this is where we get into things such as redlining, structural racism, whether or not individual veterans in that community or their networks have slack in their system, resources that they can float each other. And if they don't do that, if they don't have resources that can kind of fill in the gaps, what happens to the veterans? Truth be told, speaking to this relatively few problems, if tomorrow VA decides that they don't like this presentation and they finally decide to fire me and I lose my job, I lose my income, let's be honest, there's a great chance I will never be homeless in my life. I will never need these programs. Why? My dad is pretty well off. I can go stay with him. And when I get him so irritated that he's done with me, my mom is well off. I can go stay with her. My parents are divorced. And when I annoy her, and trust me, it's easy for me to annoy my mom, I have friends, I have cousins, I have a brother and sister, I have folks in my network who are all pretty well off that collectively they can float me likely long enough that I get my stuff together and I find a new job and I'm fine. For a lot of folks in a lot of communities, their networks, their friends, their families, their aunts, their uncles don't have the same resources, right? What if your community, your network, is all on fixed income, is all on public housing or on vouchers, are all receiving food stamps? A shock from one of you, right? You try your best to rally around the people who are having crises, but you don't have the resources to give. And I think that's what's really going on with this relatively few problems, which speaks to a lot of the interventions that we have to use. I think there's a lot of discourse these days about the importance of mental health treatment and substance treatment to address homelessness. And true, as you've seen just from these slides, but we cannot ignore the other parts about making sure that our veterans are financially stable and that they have access to affordable housing and access to healthcare. Let's go on to the next slide, please. All right, enough level setting. Let's give you a progress update. How are we doing in the work to end veteran homelessness? Overall, there has actually been significant progress in ending veteran homelessness. Since 2010, we've seen a 52% reduction in veteran homelessness. This is somewhat unprecedented in the history of our country and is a testament not only to the hard work and dedication of VA staff across the country, nonprofit organizations, our community partners, but also the generally bipartisan support that veterans have received over the last getting upwards to like 15 years of investments in care about the welfare of our veterans to ensure that they have safe and stable places to call home. I want to unpack what you're looking at with this slide a little bit because I have the next several slides are all going to be these type of charts that tell interesting stories. What you're looking at right here is something called the Point in Time Count Survey. It's actually run and organized by the U.S. Department of Housing and Urban Development and nonprofit organizations that are in your communities right now. We call them continuum of care agencies, right? And they are responsible for essentially conducting a homeless census once a year, usually around the end of January of each year. And they're basically counting everybody who's experiencing homelessness, including veterans. Now, what this does is it provides a year-over-year snapshot of how many veterans are experiencing homelessness, along with other Americans experiencing homelessness throughout the country, so that we can figure out how we're doing on progress, and really importantly, where we need to continue to allocate resources, where the best practices. You're looking at 3 lines here. The bright red line is overall homelessness among veterans. And you can see that's a 52% decrease since 2010. The dark red, almost maroon line in the middle is where we start unpacking that total number. The red means veterans who were sheltered homelessness. If you recall, several minutes ago, I mentioned that in the category 1 of homelessness, there was emergency shelters and transitional housing. Those two combined, if a veteran is living in those settings, they're considered sheltered homeless. And that's what this middle kind of maroon line represents. Veterans who were in emergency shelters or transitional housing programs at the time when the point in time count was conducted. The dark blue line at the bottom are veterans who are unsheltered. So think, again, literally on the streets, literally in the woods, in encampments, under bridges. If you're in a tent, you're technically unsheltered for these purposes. And that's where it represents as well. I want to kind of point out something really, really important that's a big focus for us. You can see from 2020 to 2023, right, the last 2 years, there was a jump. Veteran homelessness actually increased. It increased by about 7%. Nobody is happy about that. Everybody is frustrated about that. We're not discouraged. We're not hopeless, but it does strengthen our resolve that we need to address homelessness. There is still an overall decline, and there's still actually a decline since 2022. Veteran homelessness overall has declined by 4% since 2022. But if you notice, a big chunk of that increase is actually from unsheltered homelessness. And if you think about it, and if you think about your own hometowns, that kind of makes sense. You don't need me to tell you, you probably see it day to day. You see more people experiencing unsheltered homelessness as you go out in your communities. You see them when you drive your cars, they're out there. And we're seeing a similar uptick in veteran homelessness as well. I want to acknowledge that there's a quick question in the chat that I think is valid to ask right now, which is, what were the homeless veteran data prior to 2010? That's a great question. So my understanding is we actually don't have data prior to 2009, largely because we actually, as a federal government, didn't ask the question to ask if a person was a veteran or determine veteran status during the point in time counts until 2009. Your next question is, well, Shawn, where's the 2009 data? Why did we start at 2010? 2010, we generally use as a benchmark, largely because by then we've gotten a little bit more better with identifying veteran status during the pit counts, but it's also the start of the first federal strategic plan to end veteran homelessness. So that serves as kind of like our starting point. It's a kind of a historical bit, but it's a great question. The reason why we don't have data going back is that we actually didn't start asking the question until about 2009, 2010. Let's go on to the next slide, please. I've got a couple other slides that tell a visual story of what's going on with veteran homelessness. One of the things that's really important is that we make sure that as we reduce and end veteran homelessness, that we're ending it for all veterans. And I want to take a moment and rep for women veterans right now. What you're looking at is the same point in time count data, only from 2024, because this is actually the first year where we were able to get data, not just on veterans, but distinguishing gender. So women veterans as opposed to male veterans. So the furthest back we can go is 2024. And this is showing you that same 3 data points: overall homelessness among women, overall sheltered homelessness among women veterans, and then unsheltered homelessness among women veterans. And you can see that we don't quite have the same level of decrease. And we have a kind of a frustrating increase, actually, in unsheltered homelessness. Unsheltered homelessness will keep coming back over and over again in this presentation. It's one of the most dangerous situations a person, veteran or non-veteran, can face. There's also a question in the chat: how are the unsheltered numbers captured? That's a really great question. For better or worse, each community, there are about 400 give or take, basically jurisdictions that are conducting these homeless census. They all have kind of latitude within a certain set of guidelines to determine how they're providing these counts. Many of them are doing actual street surveys where they're going out with volunteers or staff to physically identify, count, and oftentimes survey, ask questions of the folks. Others are able to use different estimating criteria. I think we're going to have some follow-up stuff as well that we can provide. I can provide you the link. It's a little bit dry, to the U.S. Department of Housing and Urban Development's pit count methodology guide if you're really curious and want to know more and dive into the different methodology of how we determine all those. Getting back to the women veterans, I want to acknowledge that looking at 2024 to 2023 isn't helpful comparing, especially with the previous slide that just had 2010 to 2023. So if we can go one more slide ahead. And this next slide actually compares apples to apples. What you're looking at here is that same 2014 to 2023, all veterans to women veterans. And here's a thing that I think is an important thing for us at VA, and maybe you all as partners, to think about. If we're going to end veteran homelessness, we need to end it for all veterans, and we need to check to make sure that if certain subpopulations aren't experiencing and realizing the same outcomes, we need to do better for them. And what we see here is that although from 2014 to 2023, overall veteran homelessness has decreased by around 27%, for women veterans, it's only decreased about 14%. This is something that's concerning for us at VA, and this year is we've been diving in to try to better understand, but really importantly, start thinking about what are the ways we need to provide services differently to make sure that we're accessible to women veterans. Let's go on to the next slide, please. All right, I want to provide a couple other slides that tell the story of the progress. What we're looking at now, we're going back to our 2010 to 2023 data set, right? So about 13 years worth of history. And we've kept the bright red line. Again, the bright red line represents homeless veterans. But we've added a green line. And what this green line represents is all homeless people. And frustratingly, what you can see here is that although veteran homelessness has declined by about 52% over this time period, overall homelessness has declined a little bit through about 2016, has started to tick back up a little bit, and then unfortunately had a pretty large jump in 2023. That's about a 12% jump, I believe. No, actually, 12% jump from 2022 for overall homelessness, and ultimately 2.5, almost 3% increase since 2010. This is very frustrating. Now, you're probably thinking, oh my gosh, what's going on? It's got to be the drugs again. It's got to be the mental health, right? There's one last chart that I want to show you. Let's go one more slide. There's one last chart that I want to show you that kind of really tells an important story, which is about housing affordability. What you're looking at is one of our proxies, one of our kind of like, we're trying to get close to what average housing cost is. This actually looks at the U.S. Department of Housing and Urban Development's fair market rent rates, the average rate for one-bedroom units. Now, for those who are familiar with rent costs and real estate and HUD FMRs, I want to acknowledge this is not a direct comparison. This is kind of the closest thing that we can get. But what it kind of tells the story is this idea that basically during the first, 6 or 7 years, housing costs have been largely stable. But then by around 2015, 2016, 2017, they start increasing dramatically. And we see a really, really big spike from 2022 to 2023, almost a $90 increase on average for HUD FMRs. Rent is really expensive. And what this is doing is, remember the structural factors? This is a structural factor, so that if you are already had an individual risk factor, whether you just lost your job, or maybe you are struggling with a substance addiction or a mental health condition. In previous years, you might have been able to, or your family, your friends, you might have been able to float it. But with the rent costs going higher, that's the environment that's also interacting with your individual factors. And I think that's kind of what we're seeing in our data. Regardless, it's incumbent upon us at VA, and I would invite you all as well as partners to really think about ways in which we can make our programs more accessible and get these veterans into affordable housing units. And a lot of times that's going to involve a lot of things that we at VA actually don't have the ability to do. And so we rely on partners like you to help us out to fill those gaps. Let's go on to the next slide, please. I use this phrase a lot, ending veteran homelessness. And as Ms. Pauling mentioned even earlier, I even have a podcast it's literally called Ending Veteran Homelessness. So it's important to define what we mean when we say ending veteran homelessness. Now, I want to acknowledge, and you've seen it in the charts already, an end to veteran homelessness doesn't mean that nobody will ever experience a housing crisis again. And let's game this out, right? Let's assume that I have a magic wand. I don't have a magic wand. But let's assume that I have a magic wand and I waved it and I housed every single veteran who is homeless on the streets in a shelter, in a transitional housing program. They had their own place to stay by the end of the day. Great. Success, right? Press release, press conference, ticker tape parade. We did it. What happens tomorrow? And what happens the day after that? And what happens the day after that? If what you're saying to yourself is, well, Shawn, like somebody will, have a housing crisis again, they may fall into homelessness again, you'd be absolutely right. So an end to homelessness doesn't mean that nobody will ever experience a housing crisis again. What we're striving for, though, is that nobody has to experience the tragedy and indignity of homelessness, that they don't have to be exposed to the elements, that they don't have to stay in a shelter, and that every veteran has a safe, stable, accessible, and affordable home. Now, at our federal partners, the federal government, we actually have an operationalized definition. We call it the criteria and benchmarks for achieving an effective end to veteran homelessness. I know it's really long, but it really operationalizes. It provides a roadmap of how communities have actually achieved this milestone of ending veteran homelessness. And it's stuff that actually makes sense when you think about it. Do you know every homeless veteran by name? Like, not just guessing, not just estimating. Do you know everyone by name? Can you give them shelter to get them out of the elements? Do you have permanent housing resources to house everybody, and really to enough resources available so that as more veterans experiencing housing crises, you can swiftly help them as well? And can you prove all of this with data? I want to also acknowledge that achieving this milestone is only in the beginning. Sustaining this milestone and sustaining the work is just as hard, if not harder, to do. Let's go on to the next slide, please. You should know this is not pie in the sky stuff. 83 communities and 3 whole states, Virginia, Delaware, and Connecticut, have actually at some point in the past declared an end to veteran homelessness. Now, we know that, this actually, for many of these communities, has happened several years ago during the before times, but it's stuff that is doable. And we're actually reviewing a couple communities right now that might be, even in the face of increasing rent costs and inflation and the post-pandemic era, are still, able to achieve the milestone. This is something that's exciting. But what you noticed is that, this picture right here, this map, each of the blue dots, the blue stars, represents a community that has ended veteran homelessness at some point in the past. It's not filled up yet, so we still have much more work to do. Let's go on to the next slide, please. All right, I want to give you a quick just status update on our homelessness goals, which we just wrapped up for 2023. Let's go on one more slides. The work that we do is really important, and there are a lot of times where we need to set lofty goals to jumpstart innovation, to get us back to our roots. And this was really important coming out of the public health emergency for the COVID pandemic. And so last year, Secretary McDonough challenged VA to do 3 specific things. Number 1, he challenged us to house 38,000 individual veterans during calendar year 2023. And then when I say 38,000 more veterans on this slide, he actually challenged us to do that in 2022. We met and exceeded. We actually housed 40,000 veterans, so he asked us to do it again. But we wanted to make sure that when the veterans got housed, when we housed them, that they actually stayed housed. Frustratingly, it's kind of like, if you think about relapse in terms of substance addiction, or even like, a bout of cancer coming back after you thought it was in remission, there are frustratingly some valid reasons why a veteran who may get permanently housed by one of our programs but end up becoming homeless again at some point in the future. And so we wanted us to make sure that of the veterans that we housed, at least 95% of them would stay housed during the initiative. And for those veterans who unfortunately fell back into homelessness after being housed, that at least 90% of them would be either rehoused again by the end of 2023, or at least we're on a path to rehousing. And lastly, you've heard me talk a lot about unsheltered homelessness, that we would engage with at least 28,000 unsheltered veterans in 2023. Let's go on one more slide, please. I'm happy to let you know that we not only met these goals, we exceeded it. And meeting goals and exceeding goals is all well and good, but what I want to focus on are the number of veterans that were helped by VA and our community partners, the number of veterans who are homeless but are now housed. By the end of the year, December 2023, 46,552 veterans were permanently housed. Almost 96% of those veterans were still in housing by the end of the year. We know, unfortunately, that around 2,000 veterans, it's actually 1,919 veterans actually returned to homelessness. This represents about 4.1% of the veterans housed. And of those veterans who returned to homelessness, a full 1,850, or 96.4%, were either rehoused or placed back on a path to rehousing. We stayed relentless. We didn't let them fall through the cracks. And then with the engagement of unsheltered veterans, we actually engaged with over 40,000 veterans, unsheltered veterans, 40,203 veterans. All right, let's go on to the next slide, please. The thing that you've been waiting for, the VA's homeless assistance resources. I'm not going to spend a whole lot of time on here because our resources are very technical. I just wanted you to know that we have different things for different parts along the homelessness recovery journey. We're going to show it in terms of like a process map. Let's go on to the next slide, please. All right, so this here is a graphical representation of the different stages that a veteran may go through when they experience housing crises, right? A lot of times, there are a lot of veterans out there right now. They're in their own place. They have their own home. They have their own apartment, but they may be facing a financial crisis. They may have just lost their job. Their landlord may have increased their rent by $1,000, right? They may be having some medical issues or other bills that are coming up, and they're facing a housing crisis. We have at VA prevention services that can stop all of this from happening in the first place. Keep veterans in their own homes. And we're going to talk about those programs in a little bit. For those veterans who unfortunately do become homeless, we have outreach, engagement, assessment, and referral services that basically serve as the front door, not only for VA, but for the broad array of homeless programs, not just for homeless programs, but the broad array of VA services, VHA healthcare, the Veterans Benefits Administration, all of that. Many of those veterans need a temporary place to stay. They might be literally on the streets right now, and the elements are bad. It's starting to get a little bit summer, which means I'm in Florida. It's going to start getting hot. And heat stroke is really, really bad. We were just coming out of winter. Frostbite is really, really bad. So we have temporary housing, residential services that can provide veterans with a place to stay right now in varying degrees of duration and with varying degrees of support. Ultimately, our goal for all veterans who are homeless is to get them back into some kind of permanent housing. Usually, when we say permanent housing, it's not their forever home. It usually means a place that is oftentimes a rental home, a rental apartment, oftentimes with short or long-term subsidies that help make rent affordable based off of that veteran household's income, and with varying degrees of case management and other social supports, other healthcare related assistance to make sure that whatever the individual risk factors that were contributing to their homelessness, we're addressing. Now, do you remember from earlier in my presentation, I talked about incarceration history being a really big predictive factor? Because of that, I want to let you know we also have outreach that goes to jails and prisons for veterans who are involved in the criminal legal system to make sure that as they are being released from those settings, they're getting connected to VA. Let's go on to the next slide, please. All right. This is the alphabet soup slide. You can see there's a lot of jargony words here. There's a lot of program things. I think we're going to make these slides available for you. These, I just want you to know that they exist. I want you, so you can Google them, you can check them out. But again, we have homeless prevention services that help veterans who are in their own place, stay in their own place, and avoid all of this stuff. Outreach services that serve as the front door if the veteran's experiencing homelessness or housing instability now. Residential services that provide veterans a place to stay if they need a place to stay. Permanent housing services that get veterans back into apartments. And then we even have specialty services as well. We have employment services because we talked a lot about finances today. Employment is a really great way to get financially stable. And so we have employment services that help veterans get meaningful employment, meaningful jobs. We have primary care that provides primary care services that are tailored to the unique challenges and barriers that literally homeless veterans face. And one of our new programs, Legal Services for Veterans, which actually provides legal assistance, oftentimes civil legal assistance, to help work through barriers like past criminal history, eviction prevention, all that stuff as well. Again, I think you're going to get a copy of this. I just want you to know that these exist. They are there for you, especially if you are a veteran who's homeless or at risk of homelessness, or you know somebody. When you get them connected to us, these are the programs we're going to get them connected to. All right, let's go on to the next slide, please. I said I want to leave some time at the end for Q&A. We've got about 19 minutes left, so I think we're going to have a pretty decent amount of Q&A. Before we get to that, though, I want to shift gears 2 more times. First, I want to talk about ways in which you specifically can help There's a couple of folks here. I recognize you. You're VA staff. This does apply to you. But if you're from a nonprofit, if you're from a charity, if you're from a church, and you want to try to stay connected and engaged, maybe you're a business owner, these are some opportunities. Let's go on to the next slide, please. Okay. First and foremost, this is what we call like a practice sort of consideration. So if you encounter a veteran who's homeless right now, or maybe not right now because you're on this webinar, but tomorrow, you're actually face to face with a veteran who's experiencing homelessness. Number one thing, be patient with them. They may not, I guarantee you, they haven't had their basic needs met. What do I mean by basic needs? They're probably pretty dehydrated. I guarantee you they didn't sleep good last night. There's a good chance they haven't had anything to eat yet today, right? They may not be aware of, when the time is. When I don't eat, I get really, really hangry, and I'm a privileged middle-class person. So imagine turning that up to 20 if you haven't eaten in days, you haven't had a good night's sleep in days. The active fight or flight is there. So be patient as much as possible. If you're working with them to get them connected to VA or us, keep in mind that there's a good chance that they actually don't have a reliable means of communication or any type of physical address to provide. And then lastly, you want to instill hope, but don't overpromise. A lot of the work that our teams do when they're working with veterans who they've identified as homeless for the first time is building trust and building confidence. And, to become homeless means that you've experienced a trauma and a lot of the world around you has failed you. And so it takes a lot of effort to build back up that trust in order for a person to feel comfortable receiving services from us. Let's go on to the next slide, please. All right, a couple things. If you want to, you can take out your smartphones and take a picture of this QR code. What this QR code would do is give you a website with a bunch of hyperlinks to a lot of the stuff that I'm going to talk about in the next few slides. However, again, I think you're going to get a copy of this slide. So if you don't want to do the QR code just yet, you can still just get the slides. But if you do want to use the QR code, again, it will take you to VA's website with a bunch of hyperlinks to the things that I'm going to talk about next. All right, let's go on to the next slide, please. If you want to get to know your homeless program staff, let's say you want to develop a partnership. Let's say you want to do maybe like a homeless veterans event, but you don't know who your local VA staff point of contact are. Shoot us an email, homelessvets@va.gov. That comes to my team. We'll get you connected to your local VA so that you can figure out locally what are the opportunities for partnership. Let's go on to the next slide, please. If you know a veteran who's homeless or at risk of homelessness, maybe you are a veteran who's homeless or at risk of homelessness. Again, phone trees are frustrating. It can be, VA is big. It can be difficult to know where precisely to go to get help. So we've made it easy for you. Call our national call center, 877-424-3838. The call is free, confidential, available 24 hours a day, 7 days a week, and staffed with trained professionals who will get you connected to your nearest VA for help. National Call Center for Homeless Veterans, the easiest way to do it. 877-424-3838. All right, let's go on to the next slide, please. There are potential opportunities for making an impact, especially if you are with a corporation, you're with a church, and you want to maybe do some donations, you want to do some events. There are a lot of different opportunities, especially to fill gaps in services and resources that VA lacks statutory authority to do. Super 5-second civics lesson. VA and other federal agencies are only really allowed to do this. We're only allowed to do the stuff that Congress gives us permission to do. It's literally like on whose authority? On congressional authority. And so if Congress doesn't give us authority, like we can't do it, whether or not it could be a great idea. But if we don't have the authority to do it, it's not us passing the buck. It's literally like how our government works. What that means is that there are opportunities in the meantime, in the short term, to address those gaps. And that's where, good partners, donations could come in. If you want to get to know your local Center for Development and Civic Engagement office, this formerly known as Voluntary Service, we've included a hyperlink here as well. You can reach out, see if there's opportunities where you can make an impact as well. Let's go on to the next slide, please. All right, stand downs. Stand downs are really, really great. These are 1 to 3 day events that happen in your community, which are kind of like resource fairs. Think like a job fair, but instead of employers, it's different resources that homeless folks, including veterans, can access services. If you're curious about if there's going to be a stand down in your local area, in your town, check out our upcoming stand downs page. We update this basically every 2 weeks as new stand down events come on board. And we have them listed out by day, but you can also kind of do a quick search by your state or city and check it out. Let's go on to the next slide, please. If you are a landlord, if you are somebody who knows a landlord, a housing developer by chance, rent to our veterans. All of this work, fun fact, VA doesn't own apartments. And I mentioned the whole like statutory authority thing. VA doesn't have statutory authority to build apartments. So if you've ever wondered why, like, I suggested to the secretary that they convert these into housing units. It's a great idea. We lack the statutory authority. All of the work that has been done to end veteran homelessness relies on just the regular housing market, just the regular renting market. And because rent is getting more costly, it's really, really helpful when we have those property owners, those housing providers, those landlords who are mission focused and who want to rent to the veterans in our programs, because that's how they get housed. We have a bunch of housing subsidies, but if we don't have housing units for those veterans to rent that are affordable for them, it doesn't do anyone any good. So if you are a landlord who's interested, shoot us an email. We'll get you some information, and we'll get you connected to your local VA, especially if you have housing units where veterans can rent to today or in the near future. All right, let's go on to the next slide, please. If you're a business owner, hire our veterans. We talked a bunch already. Our veterans, many of our veterans are employable. They have great skills and they're looking for work. If you want to know how to get connected, we have a category of staff person called a community employment coordinator. Their job is to not just help veterans get jobs, but kind of like foster an employment community in your community. We have our community employment coordinator directory link here. So if you're an employer, you want to get to hire some veterans, especially those who are coming through our programs, find your local community employment coordinator, reach out to them, have a great conversation. All right, let's go on to the next slide, please. Shifting gears one last time, couple opportunities to stay connected and engage with us. Let's go on to the next slide, please. If you'd like, sign up for our newsletter. It comes out once a month and it has a lot of great information. Message from our executive director, Monica Diaz, information on grants, good news stories about veterans who are no longer homeless but are now housed, other great updates. The easiest way to subscribe is go on to va.gov/homeless. You'll get a little pop-up, ask you to put in your email, and there you go. You'll join us on our monthly newsletter. Let's go on one more slide, please. And then lastly, you can check out our podcast, Ending Veteran Homelessness. If you've enjoyed hearing me talk, some of you might have actually enjoyed hearing me talk today, and you want to know more, the podcast is a great way to do it. It comes out once a month, and it offers a really demystified look at the work that we're doing. There's so much jargon, there's so much technicality, it can be very, very confusing. And this podcast is really meant for you in a really, really accessible way. It's right now available on all the standard platforms, Apple Podcasts, Spotify, Audible, your podcatcher of choice. Okay, that's my last slide. Let's go on one more. And yeah, that's all for me. We'll go to Q&A. I know there's some questions that have been provided to me from the chat. I really, really want to thank you all for the time. Hope that you found this valuable and you feel empowered in our collective work to ensure that every veteran has a safe and stable place to call home. Thanks.
Thank you, Shawn. Thank you so much for that very informative presentation. We are so grateful for all of the information today. It's been great. We're going to go ahead and get to the questions. We have about 14 minutes, and I think we can get around to all of them today.
Great.
So let's get started. The first question comes from Eleni. What are the homelessness veteran data prior to 2010?
Yep. So that one we got a little bit earlier, but I'll definitely say it again. We actually, the earliest that we have in homelessness point in time count data goes back to 2009. And for a very understandable reason, that was the first year when then as a federal government, we actually started asking the question, are you a veteran or did you serve in the armed forces? So we only really have data that goes back to 2009, and we use 2010 as our benchmark because that was actually the year when the first federal strategic plan to end veteran homelessness launched.
Okay, thanks. That makes a lot of sense. Third question is coming from Carmen. I am completing a proposal for a self-sustaining ministry. Once completed, I will be looking to break ground in South Carolina. How do I access funding, if any suggestions?
Yeah, great question. So what I'm going to do, I'm going to drop a link to an article in the chat. Hopefully is the chat working? I think it is, or it's not. Or true, if I can provide this to you a little bit later. I think it's also in our resource links. So if you actually will do the QR code, what it is, it's an article that explains all of the different funding ways that VA partners with different organizations, whether you're a nonprofit organization, a mental health treatment facility, or if you're a landlord, and specifically how you would get started with that. A lot of it depends on what type of services that you're interested in providing. But if you check the VA resource link, there's an article, and Drew, I'll make sure to get it to you after that we can share in the follow-up. The article is called So You Want to Do Veteran Housing. It's really, really helpful. It goes through all 4 of our big programs that are the main opportunities for us to partner with folks in a funding way to house homeless veterans.
Thank you, Shawn. Next question, Ben, from Mr. Ben Hodge. Will a sketch be given of how providing supporting housing for unhoused veterans occur in a county or city? Does the VA seek out existing local organizations to partner with, or might the local entities that intend to provide housing to homeless veterans know to engage with the VA or HUD?
Yeah, no, that's a really great question. So I'm going to answer it in 2 ways. The short answer is it depends. Insert one VA joke here, but it depends for a really kind of like historical reason that a lot of the work, veteran, non-veteran light, to address homelessness has been decentralized and really kind of empowered by local communities. And so it looks different from community. That said, yes, we absolutely partner with existing local organizations. And part of the reason why we do presentations like this is to raise awareness of those local entities so that they know how to get connected to their local VA to partner. I want to acknowledge, when it comes to partnering and providing housing, 2 of the main ways in which we work with local organizations are 2 of our major grant programs. One grant program we briefly saw from the alphabet soup slide with all of the program names is called Grant and Per Diem. It's a pretty jargony term, but it's a way in which that we partner with nonprofits and actually provide funds to provide transitional housing, so short-term housing. We also have a grant program called Supportive Services for Veteran Families that these grants are awarded, again, to nonprofit organizations and consumer cooperatives to provide homelessness prevention assistance and rapid rehousing assistance. We also work in some of our other programs with housing providers to actually develop veteran-focused housing projects, so actually apartment buildings that are focused for veterans or maybe have some veterans as well. So there are a lot of different options. Because the landscape is so complex, one of the easiest way to try to get connected, just send us an email, homelessvets@va.gov. We'll get you connected to your local VA, and we'll see what opportunities are there.
Thank you, Shawn. We're going to try to get through all of these if we can. We cannot get through your question today. We will provide these questions to Mr. Liu, and he will provide a response directly back to you as soon as he can. Question 5 is coming from Daryl Brown. Is there a source to get information for Alaska broken down by region, such as Anchorage, Interior Villages, Fairbanks, and the Southeast communities? Does the information include gender, age, time and service number, percentage of breakdown?
Yeah, that's a really great question. Unfortunately, no, we don't have a public-facing repository for that information. True, what we can do, though, is we can provide the information to the U.S. Department of Housing and Urban Development's what we call the annual homeless assessment report. That at least will get you some information about veteran homelessness in Alaska. It is broken out by what we call the continuum of care geographies. So it's not going to be, won't necessarily be the regions that you described here, but we can make that available to you.
Next question comes from Tracy, and thank you, Mr. Brown, for that question. What has been done to simplify the process of applying for VA support services and making it easier, AKA less confusing and confounding to navigate the VA system?
Yeah, that's also a really great question. So I want to kind of like put some guardrails on my response here. I'm going to answer this in the context of homeless programs, acknowledging that this is probably a little bit broader and speaking to the greater VHA Veterans Health System as a whole. You know, I think what we've done in the past and what we're continuing to do is, number one, making that call center number really available far and wide. It can be so frustrating to try to figure out where is the door and where is the front door, and that call center just makes it so that's so easy because it gets you. The call center ties directly into our local VA, your local VA medical center homeless programs. From there, we've been working on our end to, we have a lot of different programs. Historically, a lot of those programs have worked in silos. So we're working our best right now, last year and in this year as well, to reduce those silos, to make it easier so that rather than worry about program, the veteran just comes to VA and we'll take all the merging of the programs for them.
Thank you. Next question coming from Mr. Richard Bauer. How is the sharp increase over the last 2 years in non-U.S. citizen migration affecting the ability for the VA to find places to house the veterans? Is housing the non-U.S. citizen migrants being done over the veterans?
Oh, that's a really important question and very timely. The short answer is we have not heard any negative impacts of the increases in migration affecting veteran services. We know that it has affected non-veteran homeless services, but because of the way VA's programs are structured, some of the existing relationships that we have, I know we're getting into the specifics of like, what is emergency housing or permanent housing, but we have not heard any negative impacts from the recent upticks in migration on the impact of veteran homelessness.
Thank you, Mr. Bauer, for that question. Next question coming from Jen. What if we are veterans, but we have housing and training to assist veterans? How do we become a contracted provider?
Excellent. Yeah, that's another one where you definitely check out that article. So you want to do veteran housing. We're going to make that available for you, but it's also available right here on the VA resource links that you can check it out because that's going to tell you precisely what are the opportunities what are the specific opportunities in homeless programs where we would get into a kind of like a financial or contracted or grant arrangement.
Next question comes from Lydia. We have about 5 minutes, Shawn. Where can we get information on the resources other than Googling it? And the homeless healthcare, how is it different than the regular VA healthcare system?
So depending on what information that you're interested in, that's another one where I would recommend shoot us an email, homelessvets@va.gov. Because if you're interested in what's going on locally in your community, the best thing for us to do is just connect you to your local VA homeless program, and they can share with you from there. I'm not sure I understand the question. How is homeless healthcare different from regular VA healthcare? What I can say, this might be a reference to our homeless patient aligned care team, which is just a really, really great program that, actually, I think this is what this is a reference to, that provides tailored support. And what it does is a couple different things. Number one, this is jargon, so I apologize. The panel sizes are smaller, so the doctors have fewer patients to work with, which means they can spend more time with each individual patient. It's not like a 30-minute and then you got to go, I got to see the next person. They have other things too, such as open walk-in hours. So one of the hardest things for a person who's homelessness to do is to meet an appointment. Why? Transportation is probably, they don't have transportation. The bus service doesn't align with our scheduling, and they may not have a watch to even know and be oriented to time. So our homeless patient aligned teams, they just don't have appointments. You can just walk in and it's really, really accessible. There's some other things that as well that gets into the training, but those are the two biggest changes.
Okay, thank you so much, Shawn. We have a few more minutes. Next question is coming from Mr. Richard Valdez. With respect to HUD-VASH and the AMI income eligibility threshold, and I'm not sure what AMI stands for, and you probably do, Shawn.
I do. Yep.
what is VA doing for 100% service-connected disabled are denied when their VA compensation puts them over the AMI income eligibility?
Yeah, this is a really great question. I'm going to spend just a couple seconds unpacking it so folks can follow along. So this has to do with income limits or income thresholds, how much money you can receive and still receive the benefit. AMI stands for area median income. It's determined based off of your community, right? And it's basically of all of the different incomes in your community, the full range of incomes, what's right in the middle? That's what median means. So area median income is what is the middle income for your community. And that middle income is used to determine income limits. Meaning, if you receive money over this, you would no longer be eligible for services or assistance. And what frustratingly that means is that in some communities, some veterans, especially those who receive 100% service-connected pensions, are unfortunately over the area median income, but despite their finances, still need the supportive services. I don't have a good update for you on that other than to say this is something we are very aware of. We have a team that is working diligently on finding solutions for this. It's something that nobody is happy about. We're all frustrated with it. I unfortunately am not the SME, but I can tell you that we are very, very focused on finding solutions for this particular problem.
Thank you so much, Shawn, for everything today, for all of your collaboration and support for this webinar. We're running out of time. We do have to cut off here at 3 o'clock or be shut down. If you need to reach out to the presenter, his information, point of contact information is on the screen. You can reach out to our team as well if you need additional information. At this time, this concludes today's presentation. If you registered for this webinar, we will provide you with today's presentation. As I mentioned before, we did not get around to your question. We will provide those questions to Mr. Shawn, and he will get directly back to you if you provided your email address or point of contact information for today's registration and when you registered. A recording of this webinar will be provided on our website at a later date. Please subscribe to our website and Facebook for future webinars and information. This adjourns today's presentation. Thank you for joining us today and have a great day. Thank you. Bye-bye.